Antihypertensive drugs. Full information introduction. Hypertension =, sustained BP. 140/90ths mmHg or 130/80 as per some guidelines. Chronic hypertension damages the heart, brain, kidneys, retina, blood vessels. Antihypertensive drugs lower BP by affecting cardiac output, vascular resistance, or blood volume. One, diuretics. Mechanism: promote sodium and water excretion, blood volume, cardiac output, and BP. Types: 1. Thiazide diuretics. Example: hydrochlorothiazide, chlorthalidone, indapamide. Site: distal convoluted tubule. First line for mild to moderate hypertension. Side effects: hypokalemia, hyperuricemia, gout, hyperglycemia, hyperlipidemia. 2. Loop diuretics. Example: furosemide, bumetanide, torsemide. Site: loop of Henle. Use: severe resistant hypertension, hypertensive emergencies, renal failure. Side effects: hypokalemia, ototoxicity, dehydration. 3. Potassium-sparing diuretics. Example: spironolactone, eplerenone, amiloride. Site: collecting duct. Use: resistant HTN, heart failure, hyperaldosteronism. Side effects: hyperkalemia, gynecomastia, spironolactone. 2. Sympatholytic, antiadrenergic drugs. A. Beta blockers, B blockers. Example: propranolol, atenolol, metoprolol, carvedilol, nebivolol. Mechanism: block B1 receptors, heart rate, contractility, renin release. Use: young patients post-MI, heart failure, arrhythmias. Side effects: bradycardia, bronchospasm, avoid in asthma, COPD, fatigue, masking, hypoglycemia. B. Alpha-1 blockers. Example: prazosin, doxazosin, terazosin. Mechanism: block A1 receptors, vasodilation. Use: HTN with benign prostatic hyperplasia, BPH. Side effects: postural hypotension, reflex tachycardia, dizziness. C. Centrally acting drugs. Example: clonidine, methyldopa. Mechanism: stimulate A2 receptors in brain, sympathetic outflow. Use: methyldopa safe in pregnancy, clonidine for resistant HTN. Side effects: sedation, rebound hypertension, if abrupt withdrawal, hemolytic anemia, methyldopa. Pause for transition. 3. Calcium channel blockers, CCBs. Mechanism: block L-type C2+ channels, vascular smooth muscle contraction. Types: 1. Dihydropyridines, vasodilators. Example: amlodipine, nifedipine, felodipine. Use: hypertension, angina. Side effects: reflex tachycardia, ankle edema, flushing, headache. 2. Non-dihydropyridines, cardiac selective. Example: verapamil, diltiazem. Use: hypertension with arrhythmias, angina. Side effects: bradycardia, constipation, verapamil. AV block. For renin-angiotensin system inhibitors. A. ACE inhibitors, ACEs. Example: captopril, enalapril, lisinopril, ramipril. Mechanism: inhibit ACE, angiotensin 2/aldosterone, vasodilation, and natriuresis. Use: hypertension, diabetes with proteinuria, chronic kidney disease, heart failure, post-MI. Side effects: dry cough, angioedema, hyperkalemia, renal failure, and bilateral renal artery stenosis. B. Angiotensin II receptor blockers, ARBs. Example: losartan, valsartan, telmisartan, olmesartan. Mechanism: block at 1 receptors, prevent vasoconstriction and aldosterone release. Use: alternative to ACE inhibitors, no cough. Side effects: hyperkalemia, renal failure, and bilateral renal artery stenosis. C. Direct renin inhibitor. Example: aliskiren. Mechanism: inhibits renin, prevents Ang-I formation. Use: hypertension, rarely used. Side effects: similar to ACI ARBs. Five. Vasodilators. A. Direct vasodilators. Hydralazine, arteriolar dilator, used in pregnancy, HTN, heart failure, with nitrates. Minoxidil, opens K+ channels, used in resistant HTN, also causes hypertrichosis, hair growth. Side effects: reflex tachycardia, edema, lupus-like syndrome. Hydralazine. B. Nitroprusside IV drug, releases no vasodilation. Use: hypertensive emergencies. Side effects: cyanide toxicity with prolonged use. 6. Other agents. Alpha-2 agonists. Moxonidine, rilmenidine. Newer central drugs with fewer side effects. Endothelin receptor antagonists, bosentan, used in pulmonary hypertension. Aldosterone antagonists, eplerenone, spironolactone, especially in resistant HTN. 7. Hypertensive emergencies, IV drugs. Sodium nitroprusside, labetalol, nicardipine, phenoldopam, esmolol, hydralazine, SP in pregnancy. 8. Antihypertensive use in special conditions. Pregnancy, methyldopa, labetalol, hydralazine, nifedipine, avoid ACI-ARB. Diabetes with proteinuria, ACI-ARBs, asthma, COPD, avoid non-selective B blockers. Chronic kidney disease, ACI-ARBs preferred. Heart failure, ACI-ARB plus B blocker plus diuretic plus aldosterone antagonist. Summary. Antihypertensive drugs are classified into diuretics, sympatholytics, CCBs, RAAS inhibitors, and vasodilators. Choice depends on patient's comorbidities, age, ethnicity, and tolerance.